Hello, my name is Lakeisha Cotton, and today I will be doing a presentation on the national opioid crisis. As a result of listening to this PowerPoint, my audience will be able to describe the national opioid crisis, identify statistics associated with the national opioid crisis, identify the impact that the crisis is currently having on this country, identify signs and symptoms associated with opioid abuse, and identify ways in which we can help with the crisis. What are opioids? Opioids are narcotics that are used for pain relief, and they're usually prescribed by either a physician, a nurse practitioner, or a physician assistant. How do opioids work? They bind to receptor sites in our body and they tell the brain, hey, you're not in pain anymore. So it's really good for pain management. What are opioids? Like, what are the names of some opioids? So names of opioids include codeine, hydrocodone, morphine, Demerol, Percocet, heroin, and methadone. Opioid addiction. What causes a person to become addicted to an opioid? Addiction can occur. The person just starts to really like the euphoria feeling that they get from the pain medication. Just using them over extended a period of time can cause someone to become addicted, and just using them on a regular basis. What are the signs and symptoms of opioid abuse? These are important because you can recognize these signs and symptoms in someone you could really help someone if you knew the signs and symptoms, and if that person was abusing opioids, you could possibly help them, help them save their life, get their lives together. So the signs and symptoms that one should look out for include vomiting, sedation, maybe even constipation, respiratory depression, drowsiness, and a weakened immune system. And now I'm going to share with you guys some statistics that are associated with the opioid crisis. These statistics, one is from 2000 and 2014, close to 500,000 Americans died due to overdose. And at least half of those patients that died, they died from using a legally prescribed drug. Okay. And so people at the CDC are saying that the rising rates of opioid prescriptions are a driving factor in the 15-year increase of the opioid death rate. So the more prescriptions we have for opioids, the higher we see the death rate. What could we do to combat this crisis? Things we could do is decreasing the availability of prescription opioids, decreasing misuse, talking with our patients, inform them, there is a chance that you could be addicted, how, the signs and symptoms of addiction, how to seek help if you feel like you are becoming addicted. Those are ways we can help. And we can also let them know, like, hey, if you get prescribed an opioid, you cannot get the prescription and give it to anyone else. You have to use it for yourself, otherwise it's a federal offense. And we can also educate our patients, how do we dispose of opioids? There's a certain way that we should dispose of opioids so there won't be a chance that someone can get them and use them and abuse them. And also, as providers, we must, look out for signs and symptoms and just educate our patients on ways to not become addicted to opioids. And that is all. Thank you for watching my presentation.